In this video, we'll talk about the anterior teeth selection. So for anterior teeth selection, you must remember a few points. The methods that are used for anterior teeth selection. So starting from the first method, it is the pre-extraction records. Pre-extraction records. Second method is anthropological parameters. Then we have the theoretical concepts. Alright, now coming on to the pre-extraction records. So, as you know, pre-extraction photographs, casts, then the extracted teeth of known ones, relatives. Alright, now anthropological parameters. Anthropological parameters are basically certain mathematical formulas that derive to the size of the tooth. Yeah, one more thing to remember. In anterior teeth selection, basically you refer to parameters such as size, color, form, shape. Okay. Last priority is functional efficiency. Okay. Now anthropological, back to it. For this, you just need to remember all the formulas that I will enlist here. All right. So you just have to mark them up. So width of central incisor is derived from circumference of head by 13. All right. Then total width of upper anterior is by zygomatic width upon 3.36. Okay. Then total width of lower anterior is basically the 4/5 of the upper anterior width. Width of maxillary central incisor is by zygomatic width by 16. Okay, width of maxillary central incisor can also be calculated by length of face by 20. Okay, then um, width of nose is equal to combined width of anterior teeth. Now, just remember certain names. Alright. For this, remember Sears formula, Berry's formula. Alright. So this is the anthropological measurements. You can make certain diagrams, like you can draw a person and you can show this as the circumference of head. Then you can draw something like a female by zygomatic width. Okay. H-Pounds formula. Then one more is anatomical landmarks, using anatomical landmarks. Over here, we can take the help of canine eminences. Basically, it is the distance between the two canine eminences. A canine eminence is present between first premolar and canine after extraction. So this will give us the width of anterior teeth, okay, combined. So second parameter that you can use is size of maxillary arch. So in this, what you do is we take the distance between the, I'll tell you, suppose this is our maxillary arch. We take the distance between two hamular notches and between the incisive papilla and the hamular notch. This gives us the combined width of the anterior and the posterior teeth combined. Okay, width combined. Then you can use the buccal frenal attachment. All right. In this, two markings are made along the residual ridge, and then we get the combined width of the maxillary anteriors. Then another thing that we can use is corner of mouth. Basically, marks the distal end of canine. All right. Now coming on to the another method also you can use is um, basically the ala of nose. All right. In this, since like suppose this is the ala of the nose, and this will give us the combined width of the anterior teeth. All right. Now let's talk about the theoretical concepts. For theoretical concept, the first concept that should come into your mind is Winkler's concept. Now, Winkler concept says that the teeth should be arranged according to fulfilling three parameters. The first one being the physiological parameter, second one being the biomechanical parameter, and third one being the psychological. Now, physiological is basically the facial musculature, all right? So, we should have the teeth in such a way that the thickness of the denture base should fulfill, all right, and should give the appearance of the face as we want in the patient. Biomechanical is we should arrange and select the teeth in such a way that they fulfill the biomechanics of a denture. All right. Now, denture also teeth should be placed in neutral zone. Very important to remember. Teeth should be placed in neutral zone. Neutral zone is basically the zone in which there is a balance between the buccal and the lingual musculature. Psychological also very important. Basically, patient if he has a positive self evaluation, he will give a broad smile. All right. If it is a negative evaluation, then the smile will be taped and it will be very small smile. All right. Very important is Camper's line. Now, it is a line which is drawn from the tragus till the lips, all right, or the ala of the nose. So it is raised in people who are happy, usually happy, and it is flat in people who are mostly sad or depressed. All right. Then second concept that we will talk about is the typal form theory. This was given by Leon William. Always remember the name of the person who was given the concept, Leon Williams. Now, Leon Williams said that the size and form of the anterior teeth. There are basically, we can either have squarish, rectangular, tapering, and squarish tapering. He said that if the face is tapering down, suppose if we have some person like this and the face is tapering down, so we should select the tooth which is tapering upwards, that is opposite of the face taper. All right. But this system was opposed, this concept was opposed by Steen. He said that it is the most important factor, and this is not the right concept, and we must do it accordingly to the tooth itself. Then coming on to the another concept, which is temperamental concept. In temperamental concept, uh, basically, as we read in 11 12, there are basically humors in humans, phlegmatic, choleric, and sanguineous, and so on. So accordingly, we should do the teeth selection. So remember, the temperamental concept was given by Dr. Spars Heen. All right. So then this is the third one. Then coming on to the next page. I'll just write it here. So yeah, the fourth concept is the harmony concept. Yeah. So it is basically concept of harmony. Now, this concept was given by Dr. J. White. J. White. Now, this says that the size and the color of the tooth should be in harmony with the size of the head and the color of eye. Size of head and color of eye. Also, it enlisted another factors also, like size of face, interart spacing, length of lips. Okay. Now coming on to the form of the teeth is selected based on the facial form. Then there was one more concept which is very much in use these days, and also dentogenic and dynesthetic concept, and is usually asked in exams. So remember, it was given by Frush and Escher. Now, dentogenic concept and dynesthetic. Yeah. So dentogenic, as the name tells us, it is basically the art, practice, or technique of giving an illusion of natural teeth through artificial dentures based on elements based on patient's elements, like, now very important, spa factor, sex, personality, and age. Okay, remember this. Now, dynesthetic is basically a Greek word which means dynamics or it means power. So this is basically a auxiliary to dentogenic concept. All right. Over here we take consideration of the tooth, the matrix. All right. Now, according to the sex, in females, what we see is the incisal edges, they are rounded, but in males it is not so. Okay. Then the mesial ends of the laterals of the female, they are hidden by the centrals, whereas in males we see the canines are prominent. All right. In personality, if the person has a vigorous personality, we will give them broad teeth, and if the person is having um, if the person is not so vigorous, then we will give flat teeth. In executives, we usually go for smaller and symmetrical arranged teeth. Then in age is also a very important factor. Now you cannot give the teeth which resemble the young people. So in age also, there is difference between the amount of the tooth exposure below the lip line. All right. Then coming on to the color. Now in color also we have four parameters. One is hue, one is saturation, chroma. Basically saturation is chroma. Yeah. And then we have value, and then we have something called as translucency. Okay. Now hue, it basically denotes the specific color. Okay, okay. Saturation, basically the intensity, that is the area, amount of color per unit area. Then value is basically indicating the brightness, basically lightness or saturation, yeah, such yeah, dilution of the color. Then translucency, how much light it can allow to pass. All right. Then uh, in people of younger age we will give lighter teeth, but in older people we will give opaque and dark teeth. All right. Then we also have to take into consideration while giving thinking about color is the habits of the people. If they are smokers, alcoholics, or punctuous, then we can give porcelain teeth, because porcelain teeth do not stain. Okay. Then complexion is very important. Color of eyes, it is said that color of eyes is important, but however it is very unreliable. Then there is also one parameter which is color of patient's hair, which is again unreliable. All right. Then there is one more thing to remember. It is the squint test. Now in this what happens is, the dentist, he closes one of his eye and he places the teeth around the near the face of the person, and then he partially closes one of his eyes, and or both the eyes, and to decrease the light, and then he compares the artificial teeth of the lip color shade to the face. All right. Then the color that is fading first is the color which is usually very close to the face and is usually used. Okay. Then functional efficiency. In functional efficiency, basically we can give two types of material of teeth in anteriors. One is the porcelain teeth, and one is the acrylic resin. Now porcelain teeth are highly brittle, whereas acrylic, they are not brittle. But porcelain teeth have high abrasion resistance. Acrylic resin teeth have low abrasion resistance. Then in porcelain teeth, it will give you excellent aesthetics because it does not stain. Acrylic resin, it will give you better aesthetics, but it stains. All right. Then porcelain teeth also, we can talk about in porcelain teeth. Um, that acrylic resin teeth can be easily polished and grounded, whereas porcelain teeth, they cannot be grounded. Now acrylic resin teeth will transmit the forces to the tooth, okay, to the mucosa, but porcelain teeth will not, so more chances of fracture. Now no clicking on contact is present in acrylic resin teeth, but here it is present. Then thermal expansion is going to be same as the acrylic denture base. There is going to be lower thermal expansion. Then this is going to chemically bond with the acrylic resin denture base. This will mechanically bond with the acrylic denture base. So this completes the anterior teeth selection. In posterior teeth selection, I'll be making another video. So I hope you liked the video. If you liked it, do subscribe to my channel. Thanks for watching.